Cleveland is home to the world-famous Cleveland Clinic. More than 43,000 people make it the city's largest employer. The clinic has been ranked America's #1 heart hospital for 21 straight years. Overall, it is among the nation's 5 best hospitals. Dr. Toby Cosgrove joined the clinic 41 years ago. He is a decorated war veteran, cardiac surgeon. In 2004, he became CEO and president. Welcome.
Well, it's very nice to be here.
It's a pleasure to be in your city.
Yes.
Well, we're delighted to have you.
Which leads to the question, how is the Cleveland Clinic preparing for this convention?
Well, all of the hospitals in Cleveland have come together in a planning process that started 6 months ago, and we've had everything, every scenario you can imagine. We've had tabletop exercises. We figure out how we can staff the emergency rooms, how we can staff the hospitals, how we can look after a surge of up to 1,000 people, and it has been a fabulous coordination across the entire organization. We're looking after people getting sick or trauma. Trauma was our major concern, but happily we've had none of it.
Trauma was your biggest concern because what?
Well, we were concerned about violence. And I think the police presence here, which is really
comforting,
very comforting, has quelled any possibility of that happening.
I want to talk to you because the outcome of this election will affect health care in this country. Hillary Clinton has said that she will build on Obamacare. Donald Trump has called it a disaster. As a hospital administrator, what is your take?
Well, I think it's unlikely that we're going to see the health care bill dismantled. I think we're going to see continuing improvements on this. We have to have more wellness activities to get people keep people from getting sick, and we have to have an emphasis on that. But I don't think we're going to see something that's now 6 years in the process totally dismantled.
Go ahead.
Well, I was just going to say healthcare premiums, though, keep going up. I mean, the Obama administration promised that it would make healthcare more affordable, and it hasn't. Premiums are up 13% in California, for instance. How do you bring down the cost of health care?
We have to bring down the cost of health care really in 2 ways. We have to have the health care delivery system become more efficient. And one of the ways we can do that is we can bring together systems instead of having essentially a cottage industry. We can bring it together so that it is coordinated. So not all hospitals be all things to all people, but essentially work together as a system.
That's exactly where I want to go in terms of a report card on Obamacare. Where is it working and where is it not, in addition to the question of premiums?
Well, what we see is access. We got now 20 million more people covered. We still don't have everybody covered in the country.
And access was their principal objective.
That was one. I think affordability was probably their principal objective. But we've seen gradual improvement in the quality metrics. We report almost 100 quality metrics to the federal government each year. And they are gradually improving.
And where has it failed?
Well, I think the biggest question is about affordability. Have we been able to reduce the rate of inflation of healthcare? Now, it's come down since 2010. We've seen a continual downward trend. We reached a low last year of 2.6%, but it's headed up this year to about 5%. And I think that's probably because more people are covered, more people are older, and there's more things we can do for people.
41 years on the job, Toby Cosgrove. Something tells me you must like what you're doing.
I've got a great job.
But I have to say this, Cleveland Clinic has reduced the cost of care by $600 million over the last 3 years. Other hospitals are closing. So how are you able to do what you do and others cannot?
Well, we have no sacred cows. We looked at everything. I mean, it's not just cutting the grass every other week and washing the windows once a year. We have looked at everything. But the most important thing is we have to change the way we deliver care. I mean, one of the things, for example, is we are having what we call shared medical practices. And that's when, say, 12 people with diabetes all get together and they get their instructions at the same time. It's interesting that they like it. It's like group therapy. It really helps them understand their disease better, and it's very efficient for the doctors. So we're looking at all kinds of ways we can do this. But mainly, we have tried to drive the efficiency of how we take care of care. And by Care Pass, which we put together, they have, everybody practices the same way. And for example, in strokes, we reduced the cost of strokes 25%.
Can I ask you about Ronald Reagan was 69 when he was elected president. He later developed Alzheimer's. We have the 2 oldest presidential candidates in history. Yes. Hillary Clinton is 68. Donald Trump is 70 years old. Do you have any concerns?
Well, I think we're seeing a healthier, older population across the country, so I'm not surprised to see this.
Yeah.
But I think everybody knows as you age, you have a higher incidence of disease than you do earlier. And quite frankly, the presidential job, I can't imagine anything more stressful.
Yes.
Oh, yes.
But on the other hand, this is the most exciting time in medicine we've ever seen because
Absolutely.
of stem cell, because of genomics, because of dramatic developments.
Absolutely, yeah. It is a very exciting time in medicine, and I think if you look at the two things that I think are really exciting, one, genomics, and two, neurologic disease. You're going to see neurologic disease just explode in the things that we can do for people. But also, we're challenged by autism and Alzheimer's on the two ends of life.
Toby Cosgrove, how old are you?
I'm 75.
Oh, you look awesome.
Yeah.
You look really awesome.
You look awesome.
No,
So you guys.
no, you look awesome.
We're so thrilled you were here. Thank you so much.
Thank you for
I'll
having me.
have some of
Cleveland
what
Clinic.
he's having. It's really great.